Good evening, everybody. I'd like to call the Wednesday, April 24th, 2024 full board meeting to order. Please stand for the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we'll have the reading of the mission statement from Lori.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Dana. Questions, comments, changes on the agenda? Hearing and seeing none. All in favor, say aye. Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anybody from the public wishing to speak? Final time. All right, nobody's jumping up, so we'll close hearing of the public. There's also another opportunity before the end of the meeting. Next is item 5, approval of the minutes of the regular meeting of the CMH full board held on Wednesday, March 27th, 2024. I'll take a motion to adopt those minutes.
Support.
Motion from Mark, support from Lori. Comments, questions, changes to those minutes? Hearing and seeing none, all in favor, say aye. Aye. All opposed? Minutes are adopted. Next is item 6, approval of the minutes from the CMH Board Program and Budget Committee meeting held on Wednesday, April 10th, 2024. I'll take a motion to adopt those minutes.
Support.
Motion from Mark, support from Lori, our minute crew. Any comments, questions, changes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Those minutes are adopted. All right, we'll move on to item 7, request to approve. The only new item we have is item A, which is a request to approve recommended candidates for CMH board officers. So our nominations committee chair, Lori, reached out to board members to get nominations, and I'll turn it over to Lori real quick.
Yes, so, like Phil said, I reached out. For chair, Phil Kraft. For vice chair, Selena Schmidt. For secretary treasurer, Lori Phillips. Is there anybody else from the floor that wants to nominate for one of those positions? Anybody? Okay, so I guess we'll take a vote for the 3 above that are on the slate
Yeah,
next year.
I'll move to close nominations.
I'll move to close nominations.
All in favor? Aye. All opposed?
Okay.
Officers are adopted.
Officers are adopted. Congratulations, Mr. Chair.
Thank you, everybody. And Selena is coming. She's just running late, so she will be here. Next, we'll move on to the other request to approve items. We covered all of these at program and budget, so I will take a motion to approve items 7B through H.
Support.
Motion from Megan, support from Dana. Were there any other further questions or comments on these items? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? They are all adopted. Next, we'll move on to item 8, receive and file. We have no items there. Next is item 9, resolutions. I'll take a motion to approve the resolution for Ingrid Betcher for her retirement. Motion from Mark, support from Megan. Any comments? Sure.
We can double check it.
We'll double check it.
Oh. We have both. Okay. I wasn't sure. That's what I thought. We do have an Ingrid and we have an Ingrid. Okay. With the same last name? If it's helpful, the staff.
I had a story for you.
She goes, hey, Gina.
Yeah, we will double check.
Yes, for sure.
So we have a motion and support to approve this. We will double check. on the information. All in favor, say aye. Aye. All opposed? Resolution is adopted. Next, we'll move on to item 10, the voucher listings. I'll take a motion to approve paying the bills. Motion from Donna, support from Megan. Any questions or comments on the bills? Hearing and seeing none, all in favor say aye. Aye. All opposed? Bills are paid. Next, we'll move on to the management report. CFO update with Ken. Go ahead, Ken.
Good evening. I'm going to start with the monthly financials this month. We'll start on page 2. Again, our eligibles and revenue are trending down as we spoke to last month. Expecting a 4 to 6% increase in our revenue, which includes a DCW piece. So we should see that revenue line uptick a little bit once we get into April. They're going to be pushing our adjustments through. It's retroactive, but it's going to be paid April through September. So we'll see larger payments to make up for that. I think it was last Friday or earlier this week, on Monday, we did receive the final piece of information that we needed from the state to calculate our DCW adjustment, so we can go ahead and pass that through to our providers, so it'll be more money for those codes for those providers. Having just received it on Monday, we don't know what the total of that's going to be, but it is a pass-through, so it's not going to be a huge sum of money, but it should cover some of their overtime costs, and that was the design of that once the state recognized that they had not funded us for that. Page 3, I'm going to talk about our balance sheet a little bit tonight. One of the things that I mentioned before is that we are working on the 2020 cost settlement with the state. Just as a reminder to the board, every year we file our FSR document. It's due in February. The past several years, because of the pandemic, we had quite a bit more revenue than expenses, and what we don't spend, we have to send back. So we worked through the process of the state looking at our FSR. They had some minor changes and things that didn't substantively change what we owed them. This doesn't impact current year budget or revenue. This is something that we had recorded as a liability in fiscal 2020. So we already have those dollars accounted for, if you will. So we'll be paying them about $16.5 million for our Medicaid Healthy Michigan settlement for 2020, and then just over $3 million for our general fund settlement for 2020. So those payments will actually come out of our revenue for this month or the following month. So the payments we get for them. The GF piece, we actually have to send them a payment because of the way they do it. So like I said, it doesn't impact current year revenue, and we had this accounted for every year that we do this. It builds up, and that's why our liabilities and our cash balances are so high. So they will go down after these payments are recognized. Any questions about that? For general fund? So we do have to send, yeah, we do those separately, and those numbers when we go into 2020 and 22 will actually be higher as we got into the pandemic. So flipping over to page 4, just looking at, we do have a slight revenue uptick because of some of the things I mentioned earlier. And our provider services are up as we continue to push as much money as we can out to our providers. Page 5, you can see that I try to look at both our Medicaid and Healthy Michigan buckets, if you will, combined, as we do cost settle those combined, as I just mentioned. So we are running about a $6 million surplus on those funding sources. Our CCBHC amount that we can retain locally is almost $4 million if you add up Medicaid and Healthy Michigan together in the third and fourth sections there. And then we have projecting a fully funded ISF and savings as usual. Page 6. This is where the story, as we covered before, based on the end of the pandemic, the ramp up of CCBHC services, you can see we have a lot of folks receiving non-Medicaid CCBHC services. We have to cover that. It effectively comes out of general fund. If we don't have the general fund, which we can see is the case here, it comes out of local. As I mentioned, we are running a local surplus on CCBHC. So on the net, the program is still positive, and certainly positive for the people served. You can see our state general fund by itself is running a slight deficit as well. That's a result of folks rolling off of Medicaid and continuing their services as we work through why they don't have Medicaid, trying to get them re-enrolled. Spend down's a big piece, and then some of the other initiatives we have as well that we wanted to keep going. Any questions about those fund sources and where we stand through February? Okay. The next one I have is kind of our updates on our outstanding issues, largely with the state. We have had some movement on the ISF discussions. We brought it up at a FSR meeting. The state of Michigan is expected to issue some contract language for fiscal 24, which we're currently in, and also looking towards fiscal 25 as to how they anticipate the ISF, whether one can go negative, an entity could go negative, and then our position on the ISF analysis and so on. So we'll continue to update the group. There's quite a few things, including this on my list, that we just received information for in the last couple days. So we're meeting internally, and we'll certainly update the group as we have more details. My HealthLink state inpatient, that's one I have in my list, but there has not been movement for months on that. I don't know when we're going to hear back. The methadone rate, the $19 issue, again, we just got a document, I think, on Friday as it pertains to that from the state of Michigan. We're still meeting as a group tomorrow internally to discuss it as an executive team and look at what it has in it and see if it solves some of the outstanding issues we had as it pertains to that. So again, another stay tuned thing, but we are seeing some movement on our outstanding issues with that. DCW, I talked about that one, 2020. The last thing I had is I talked about either the last meeting or the meeting before about some of the issues we're having as it pertains to Workday and the county's implementation. So at this time, we reached out to the county trying to get a tentative date of when their financial statements will be issued. There's a couple things that are tied to the county's financial statements being issued. They're due on June 30. Our auditors, as they look at our FSR for fiscal 23, will not sign off on our compliance audit until they can tie our FSR numbers to the audited financial statements. As we are part of the county, a fund of the county, those are the financial statements that we use. Reached out to the county. They indicated that they're more than likely not to make the June cutoff for those, and more likely into the August timeframe as a reality on that. So again, a couple things tied to that. We will not be able to issue our compliance report until that's done, which more than likely will result in an audit finding for us. Additionally, our medical loss ratio is one of the documents that we usually submit with the financial status report and the EQI. So we already submitted those documents, but the MLR, the state's most recent guidance and one of their findings, I believe, from an audit that they had, was tying that document into the audited financial statements. So again, we won't be able to submit that document until we ourselves can tie it to the audited financials and our compliance auditors as well. And then thirdly, we still have some fiscal 24 payroll reconciliation issues. And as a result, we do have a period 1 EQI for our fiscal 24 data due at the end of May. And more than likely, we will have to let the state know that we won't be able to submit that document either as we continue to try to reconcile these. So, any questions about that piece?
Nick?
Yep, the timing problem with the county, is that new? Is that a result of the different fiscal years of the state and the county, or?
It's new. It's because of the Workday implementation at the county. So they implemented a new accounting, payroll, and HR software, and it is a heavy lift. And they are working with us, and we're attempting to do everything we can to reconcile our numbers and get everything in order. But that's largely the.
So the county's behind where they normally would be because of a shift in the and it's due to a technical shift. Is that what you're saying?
Yeah, software shift. That's correct.
Software shift.
Yep.
So that shouldn't recur. It'll happen as the transition occurs, but in future years, it shouldn't be a problem.
I would hope not. I think this is a new year for this, so they're,
Gotcha.
I think, 7 months into their implementation, so I wouldn't expect it to continue, but also have limited control over those outcomes. So we have our own accounting software, Business Central. I think this group is familiar with that. So we record all of our transactions in there and are able to support our numbers, but they ultimately flow into the county's financial statements.
And what are the ramifications of that with the State Department?
So we did reach out to the state and let them know our situation and what's happening. They did grant us an extension to July 31. So if we meet that, great. Then I think we're in good shape overall. The ramifications, I'm not sure what the tangible ramifications are. Obviously, we'll be out of compliance. We'll have findings. We might be subject to more oversight and secondary audits, I'll call them. I think technically they can withhold a very small amount of our funding, which wouldn't impact our operations in any way. It's
But the
very small.
contract's not in jeopardy. We wouldn't be in breach of our contracts.
I believe technically we would be. Yes, we're required to submit these documents by a certain date. So.
And they've given us an extension. Do you anticipate what's the likelihood of our meeting the extension date?
I think it's low. I think we're going to miss the extension date.
Have you notified the State Department of that and asked for additional extension, or you want to wait on that?
I notified them of it in our original email that we were likely going to go into August. They granted us through July. So at this point, yeah, I'm gonna see what happens over the next couple months, and if we do get information from the county that, yeah, it's looking like August, we'll probably have to send a follow-up email and just let them know. That's what I'm operating under right now.
Donna?
I know the county, having been a long-term employee, has changed systems a number of times. Has the department thought about possibly sending a letter to the Human Resources Department? And certainly I can ask this to Tracy, asking them if they anticipate a change in the future, that they could work with the department so that, we would have a heads up so that we wouldn't have these kinds of problematic situations in the future?
If it's helpful.
I mean,
can
this
keep
is
that?
obviously
Sure.
a major problem for the department.
It is, and we have been communicating, and prior to them switching over to Workday, they were very communicative. We knew that it was occurring. What this is in simple terms is them having the resources in order to accomplish the task. I did meet with the county executive's office and say, how can we help? Everybody, including the finance department, who is challenged right now, has been very helpful, very responsive, but they're just not able to complete the task in the timely fashion that's requiring. So we're bringing this to your attention because it does cause the many complications that is, and just know that we're meeting with all of them to try to say, how can we help, offering staffing resources, offering anything that we can do to help them get there, because it's dramatically impacting us. And again, they're very responsive.
So the problem isn't with the program, it's just that, it's just not working with,
It's a very complicated software, and there's a
Right.
number of consultants and a lot of resources being put behind it. And if they're setting it up for an organization the size of Macomb County, I think there's a lot going on there. A lot
This
of
is not a
bargaining groups and
CMH
different
problem.
things. I mean,
right, I know there was a big problem with the retirees, and a lot of the retirees went nuts over it. So I know there's been problems with it, because I know there was about 3 or 4 problems with retirees, because I was included in it, but, I know there's been problems with it, the software.
yep. And
Some major problems.
Yep, they're certainly working through it. I think they might be bringing in some external resources to help. So yeah, we have, like I said, a limited. Our payroll continues to run through that system, which is probably the biggest thing. But we're largely separate outside of that. But we have to be able to reconcile our payroll software to that one, and that's one of the major sticking points right now. So
I wouldn't say there's an advantage, because we guys do have an outside source of all the tracking of the payroll, and then we also have Business Central. So we very much know where we're at. We just need to reconcile with them to ensure and certify that those match. It's the sharing or exchanging of information that is ultimately delaying this.
And I can add to that real quick too, that at our last full board meeting, the Board of Commissioners did approve some more funding for a couple more positions in the finance department, as well as contracting with a firm that would give us some temporary part-time workers as well. That's how far behind the finance department is. So the director came to us asking for help. So we're all trying to help get through this problem. Selena?
Tracy pretty much answered my question.
You turn on your microphone, everybody wants to hear you.
Tracy pretty much answered my question. My question was going to be, we recognize it this year, but what are we going to do year after year after year? Because the state is only going to tolerate this reasoning for so long. And then they're going to expect us to resolve it. But she pretty much said that it's a new thing, and that they do recognize it, and so that maybe next year won't be so bad.
just with my CFO
Yeah,
accountant hat on, it is standing up a new system is tough. I wouldn't expect it to be an ongoing problem that we have. I mean, in prior years, we're still working on it in June, but we've always got it done, and I would expect that to continue.
Any other comments or questions for Ken? Ken, is that all you had? Or you got more? Please
That's
say
all
no
I had.
more.
I'm
Good.
not gonna flip. I won't flip the page over.
Just lay it on us, Ken.
Thank you.
Thank you. Next is the interim CEO update.
So just a roll right from Ken was suggesting, earlier this afternoon, give or take 3 o'clock, you all received the board reports and a lot of the information that Ken just outlined. It has it, but it also has the additional attachments, like the MAT document and stuff. So I would encourage, if you haven't already checked it out, it will provide you a little bit more insight to some of the stuff that he just explained. Outside of that, I want to talk to you a couple different things this evening. Just as a heads up, it's not in the board report, but CMS, Center for Medicaid and Medicare Services, is now requiring 7-day authorizations. Before it was 14. I just want to bring that to your attention. It's not a concern for us. We already had an internal goal of 7 days. And I'm having the staff poll, like, are we well under that? Now, there are extenuating circumstances for authorizations that might go beyond that, but they will work towards, why is that? Is that anything that we can address? So again, it will be a contractual requirement as of January 1st of 2026, but I don't see that being an impact outside of now. Since we had an overachieving date, we probably need to move up our overachieving date to less than 7. Some of the items in the report that I want to highlight, if you didn't see it, Dr. Agnes Wars was on CBS doing Stress Awareness Month, which was April. There's a highlight in there, and I do give you the link, so if you didn't get to watch the interview, please do. She did a wonderful job. Today, we're very excited. I think it's the best part of my report is our crisis call center was certified with, it's in front of you. I gave you too much paper today, but apologize, we just got it today. It's in front of you, it's a purple, looks like this. This is the actual letter saying that they received their accreditation, yes. And then behind that, you will see the actual report, and you'll see some wonderful positive feedback, and I want to make sure to recognize Lori. Lori did the interview with, yeah, you were looking at me like, no. Just want to just make sure.
That's a long time ago.
You'll even see some really positive comments about the board's engagement in this particular service line, so I just want to make sure to thank you, Lori. You must have impressed them with your wherewithals. But in addition to that, you will see just positive comment. They, of course, exceed the expectations, but positive comment over and over and over again. There are a few recommendations. They're really high-end recommendations of how to improve. One of them you'll see on the very first page is for us to share more information with you guys. So hence, if you notice, I'm sharing the report with you that we received today as our first kind of effort to make sure you understand the amazing work that does happen in our crisis call center. Do you guys have any questions at all on that one? No? Okay. Moving on. In front of you, you also have a piece of paper that looks like this. It is Genoa. Several of you went to our ribbon cutting ceremony several months ago. I'm here to give you an update about how that relationship is succeeding in our community. Just a reminder, Genoa is a pharmacy located out of our north location. So the document in front of you is showing you from October 1st of 2023 through December 31st, because that's the data. This is data from Genoa that they were able to share. And if you notice, it is saying that 296 people who are ours, so they have their outside individuals also, came in and benefited from that. And you'll notice at the bottom, which I thought was helpful, you'll see that cholesterol was actually 93.75% of the prescriptions fulfilled. So you'll also see some of the other ones like antidepressants and blood pressure and stuff highlighted in there. So I thought it was great. In meeting with them, we have kind of quarterly reviews with them just to establish relationship, what's working, what's not working. They define this as a great success and are excited about the partnership. That's positive for us, because that allows us to continue to expand that partnership and maybe futuristically have other types of relationships in our other clinics. And just to give you a goal from their perspective, we're at, I think it was like 28%. Maximum they would suggest is like 30 to 40%. Because remember, they can, our staff love it because they can literally, it's a pharmacy. They can go up and get their own prescriptions or whatever, or the public can walk in, even though, remember, their expertise is in the provision of behavioral health related prescriptions. Any questions about Genoa? No, we're very excited and pleased. Okay. I have this pretty red and green document in front of you. And all of these documents are in the board report that you can click on to view. But just to do a high-level report on this, in our strategic plan, remember we got it out there in January, February, one of the priorities was improving our access to care, or more specifically, our timely access to care. Our state contracts requires us to have 14 days or less for your initial or first-time request. The great news is you will see, and I will try to summarize, give you kind of bearings on the document you're looking at. The columns or the little boxes to the left are fourth quarter, which is July 1st through September 30th, 2023. The next set of boxes is our first quarter of 2024, because that's our fiscal year or our contract year, and that's October 1st through December 31st of 2023. So this is from a while ago. But essentially, you'll see that last green shaded area, when it comes to children with SED, adults with mental illness, children with IDD, adults with IDD, persons with substance use disorders, all of them went up dramatically. But I want to make sure to explain to you why they went up. They went up because we spent diligent efforts on looking at the data, making sure the programming of the report was accurate. And to make a long story short, there were errors in it. So I just want to make sure to give kudos to our clinical informatics team, our quality team, and several others, because they really did spend a lot of time. And it's great to see, but we still need to focus on actually approving the services. What you'll also notice is if you look at the total number served, so on that column, it's going to be the 1, the first column, the second column in the first grouping, and then the second column in the second set of boxes. Essentially, we served an additional 751 people in one quarter compared to the other. And I want to make sure you hear me again. We might have increased services, but really it was based on our total served count went up in some of these categories by hundreds because we developed a better written procedure to get credit and document who's getting the service, when are they getting the service, and how are they getting the service. So we'll try to keep you updated with these quarterly to show the improvement. And I just want to make sure you hear, it's just not in our strategic plan, but we keep on telling the leaders this is the right thing to do. People should have timely access to care. It will make a big difference in their ultimate recovery. Any questions on this beautiful red and green? No, isn't it great? We had a party. I know it is. We had right, Helen? We'd have cheered, like it's, I don't think we're doing it justice about how excited we are to be able to make that much of an impact. Let's see. I think the other items Ken has mentioned, but again, I would really encourage you to look at the board report. We're really diligent in making sure we're sharing very specific information with you, so we want to make sure that you hear that. But the next person who's going to come up is Janet Mara, and she's going to talk about autism. I don't want to steal your thunder to introduce her, but I did want to take the opportunity just to express my appreciation. Janet recently and myself did an MEA TV and radio interview, and she, of course, did an amazing job. It'll air in the next, we guesstimate, 2 weeks or so. And then she's also been presenting throughout the area because April is Autism Awareness and thank you, got that part, Acceptance Month. So sorry to steal your thunder. I just want to make sure that she knew how amazing she is. And that's all I have.
Great, thank you, Tracy. Before Janet starts, I'll take a motion to, no, you can come on up. I just need a motion to receive and file her presentation. Motion from Selena, support from Lori. Janet, the floor is yours.
So I am Janet Mara, and I'm the autism coordinator with CMH. I just wanted to give a presentation about what we're doing for Autism Awareness Month and just kind of go over some numbers. So this month is dedicated to empowering those with autism in the community, spreading awareness about autism, and just putting an effort into including those individuals with autism in our community and fostering acceptance. So autism is a neurological and developmental disorder that can cause significant social, communication, and behavioral challenges. The CDC reports about 1 in 36 children may have autism. It's nearly 4 times more common in boys than girls. And autism can affect anyone regardless of race, ethnicity, gender, or socioeconomic background. And it's very important to realize that individuals are on the spectrum, so it can look very differently for every individual. So if you've met one person with autism, you've just met one person with autism. You can see a variety of, it is a spectrum. It's a very large spectrum. So we do our best to try to address the treatment needs at community mental health. So the autism benefit is primarily treating individuals with ABA. So ABA therapy is, a proven research evidence-based treatment. There's nationally recognized reviews for over 30 years. It's recognized by the Surgeon General. And in addition to the ABA therapy, we also have, case management, OT, PT, speech, and all kinds of things to link that individual into the community, coordinate with the schools, anything that might be helpful. Some signs and symptoms. It's critical to ensure that people living with autism have access to support and services needed to help them achieve their greatest potential. The younger you can get a child into treatment, the more acclimated they will be to receive help with social skills, communication, following directions, and ultimately have those skills needed for a transition into school. So some of the things that we're doing this year, as Tracy mentioned, doing interviews, getting the awareness out there, just explaining what ABA is. We also have a great video, a couple videos on our website. So mccmh.net, you can go on autism services. We have some great videos about ABA, introducing autism, helping parents just realize the steps that need to occur to get those services. We also are doing scholarships through children's scholarship funds. Like I said, I participate in interviews, networking within the community. Some of the children's scholarship programs that we are promoting are through Autism Play Place, Inclusively Fit, and swim schools like Aquatots. So those are some of the things we're doing. We're also meeting with our current providers. We're really trying to address the gap by getting our current providers that are very clinically sound to see what they can do about increasing capacity. So we're making an effort. I'm working with network operations. We're going to our individual sites throughout Macomb County. We have about 15 right now. And as you know, you've all approved an RFP, so we'll be working with the RFP to identify additional providers in our community. And we're really focusing on providing those after school hours because that's the need right now. We have children in school and we can't provide ABA during the day. It's not allowed. We do coordinate with the schools the best we can, but we can't supplant services. So we can't provide ABA at the same time. So we're really working with our provider network and trying to expand the weekend hours if possible, Saturday, Sunday, and after schools after 3 p.m. So, any questions?
Thank you, Janet. Are there any questions from board members? Lori, go ahead.
I just want to thank you for this. My son is going to graduate this year on the spectrum, and none of this was available. I shouldn't say none of it, but there was very little available at that time. But yet, it was with the help of community mental health that started getting these services and helping him. So I want to thank you for continuing this because his job's not going to get easier.
Right,
It's
right.
just going to continue getting harder.
You're right, you're right. I also had I have a family member that with developmental disability, and there's just, I mean, leaps and strides compared to what it was 30 years ago. I've also worked with the county for over 30 years, so I've seen a major change. And this is one program that started, and it was really focused on 0 to 6. And then we had that expansion in 2013, so they expanded the benefit from 6 to the age of 21. So it's really imperative to start with the early intervention and detection. So we're seeing, you see the numbers increasing. That's not necessarily, it's really due to earlier testing and diagnosing appropriately. So it's always a good thing. And like you said, getting treatment early can make a big difference. So, yeah.
Thank you, Lori. Anybody else? Okay. Janet, thank you so much for the presentation. We had a motion and support to receive and file the presentation. All in favor say aye. Aye. All opposed? Motion passes. A couple of reminders. Our May program and budget meeting will be on May 8th at 6 p.m. here in this room. And full board will be Wednesday, May 22nd at 6 p.m. here in this room also. Any other comments from board members? I want to personally thank Jeff for stepping up last week when some assistance was needed from one of us up here, and want to give you a shout out, Jeff. Thank you for being there and jumping in and when we needed you. Appreciate you. Anybody else? All right, we'll move on to provider comments. Any provider that's here that wants to speak to the board, give an update? No, not tonight? All right, we'll close that one and we'll move on to hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Give us your name. Anybody from the public? Anybody from the public? All right, we will close the hearing of the public, and we're going to do something we don't normally do, but we are going to go into closed session. I will take a motion to enter into closed session to discuss CEO applicants. Nick?
Thank you, Mr. Chairman. I move that we move into closed session to consider the position of CEO at the request of one or more of the applicants, and that we take a record roll call vote on that motion.
Thank you, Nick. Is there support? Support from Megan. All right, motion from Nick, support from Megan. I will do the roll call vote. Nick?
Yes.
Megan? Yes. Antoinette? Yes. Dana?
Yes.
Mark? Donna? Yes. Lori? Yes. Selena? Yes. Phil? Yes. Wayne, did I forget you? I'm sorry, Wayne. I knew I was going to forget somebody. It's just. All right, we are now in closed session. We are back from closed session. I will take a motion to invite candidates to participate in an in-person interview at a future date.
Support.
Motion from Dana, support from Megan. Any comments or questions? Hearing and seeing none, all in favor, say aye. Aye. All opposed? That is approved. Next, I will take a motion to adjourn. Motion from Antoinette, support from Nick. All in favor? Aye. All opposed? We are adjourned. Thank you, everybody. Have a good night.